How to decide which sounds to target first in speech therapy. I'm Amy Graham, a speech language pathologist who specializes in speech sound disorders. I want to talk about these kids who have so many sounds in error. Maybe there's so many sounds they're missing that we just don't know what to target first, or we don't know what to prioritize. And it's really important that we choose the right things to target, because some targets, some sounds might actually have a bigger impact on improving that child's speech quicker. And so it's really important that we think through not just what sounds don't they have. If they're, let's say, 4, what sounds should they have had at 3? Let's target those first. That's called kind of a developmental sequence, or a developmental approach to remediating their speech errors or improving their speech. And that actually is not probably the most efficient or effective way to address a child's speech sound disorder if they have so many sounds that are missing. And if you have to look at all those sounds and determine that you have to start with the ones that should have been developed earlier, should have been acquired earlier, and then target each one at a time, that child, if you think about, for example, that 4-year-old or that 5-year-old, that's going to take you forever in speech therapy to improve their speech, to improve their intelligibility. So we have to think beyond this question of at what age am I allowed to treat sounds? And I would say if you have a child who is really difficult to understand because they're missing a lot of sounds, that's the last question I ask. At what age should I begin treating a particular sound? I want to know other things about what I'm going to target. For example, what's going to have the biggest impact on improving intelligibility or improving other people's ability to understand them? And a lot of times it's considering things like the frequency of the sound that they have in error, the frequency of that sound occurring in their language. So I'm a monolingual English speaker. I treat in English. And so I'm thinking about, okay, what sounds occur frequently in English? For example, RSTLNE, does that sound familiar? That's that Wheel of Fortune show, right? That last round where they just kind of throw those letters in for free, because back in the day when people were allowed to guess what letters were going to pop up, those were so frequently occurring that everybody just automatically guessed those. And so if we think about English and the sounds that are represented by those letters, R, S, T, L, N, we have to assume that if a child has an error on those kinds of sounds, then that's probably going to impact their ability to be understood. And so we might want to actually prioritize those frequently occurring sounds, because that will have a much bigger impact on intelligibility, even if they're later developing, even if they're sounds that we may not even consider appropriate for a 4-year-old to have. Maybe they're sounds that usually 5-year-olds have. It's okay to start targeting later developing sounds. Or think about sounds that might be personally impactful to the child. So consider this 4-year-old again, who's missing a lot of sounds. What if that child's name starts with what we might consider a later developing sound? We might think, oh, you know, we don't have to work on R yet or L yet. We'll wait to work on those. There's so many other sounds to get to. But what if that child's name is Riley, right? If they're struggling with those particular sounds, they will not be able to say their name. That is going to be really incredibly personally impactful to that particular child. So it's okay to consider prioritizing something that is going to be immediately influential or personal, or increase that child's ability to improve their speech intelligibility quicker. Also, another thing we should consider is the complexity of those particular sounds. Now, what this means is usually we consider targeting earlier developing sounds first, right? That's kind of that traditional approach, like maybe the K sound or the G sound, because those are earlier developing sounds. But here's the thing. Those earlier developing sounds are not as complex. That's what makes them earlier developing, because they're usually easier to say. Later developing sounds, or clusters, let's talk about clusters for a minute. Those tend to be acquired a little bit later because they're more complicated. So a cluster is when we have 2 consonants that we're blending together in a word. For example, the word like slow, S-L, 2 consonants together, that's a cluster. So what we're learning now within the last 20 years of research is what happens if we actually stop working in a developmental sequence Like, let's start with those earlier developing sounds. Let's start with some later developing sounds, more complex sounds. What happens is they actually improve their system of production of sounds on a global level. They don't just improve the sound that you're addressing. There's this trickle-down effect where a child will actually begin to acquire sounds that are less complex, that are earlier developing, and they'll start to acquire those sounds all by themselves on their own if we start targeting something later developing, something that's a little more complex. And I know some of us SLPs think, oh my gosh, working on a cluster with a child who is difficult to understand, they're struggling with just simple sounds, that sounds daunting. I know, it absolutely can sound daunting, but I want to encourage you, because if you're at all in doubt about this complexity approach to targeting or to addressing particular sounds, learn more about this approach. I have a whole 1-hour course that walks you through how to decide the complexity, or how to decide among complex targets and decide which ones to target in speech therapy. Take that course. It's only 1 hour, and pick one child on your caseload if you're an SLP, and try to just do your own little case study and see if that child, if you choose a complex target, see if that child doesn't improve faster than the other kids on your caseload, where you might be using more of a developmental approach and working on earlier developing sounds first. Now, if you're a parent and you have a child who sounds like this, and they just don't have a lot of sounds in their inventory, they're not using a lot of sounds in speech, consider asking your speech therapist if they have considered what we call the complexity approach to phonological intervention. Because if a child is struggling saying sounds like S and F and SH, those airflow sounds, or if they're struggling with ch or j, those what we call affricates, but they're kind of these strong, powerful airflow sounds as well too, but we start off with a really powerful start, ch, j. If they're struggling with those kinds of sounds, those are perfect candidates to consider working on complex clusters. Now, what do I mean by complex clusters? Because in English, we have lots and lots of clusters that we can address. And so SLPs can get really good at analyzing which clusters to address. And there's a whole process in which we can do that, talking about sonority sequencing and all these fancy terms. And again, I go over all of that in my 1-hour course. But targeting a more complex cluster. Oh, I remember what he likes to eat. He likes to eat things that are... Right, we forgot monkey though. Sweet. Do it again. Sweet. Again. Sweet. Like, for example, a more complex cluster is SL, working on words like slow and sleep, versus a less complex cluster like ST in stop or SK in skip. Those are less complex clusters, and we don't tend to see as much improvement systemically in a child's speech if we address those types of clusters. But if we address a really complex cluster like THR, we have to find all the numbers that look like 3. There's our tongue sound and our R sound. 3. Let's do it together. I'm on still. You did it at the same time. That was so good. Tongue out. I'm waiting for you. That was it. So how many 3s do you see? Let's see. Is that a 3?
Nope.
Is that a 3?
Yep.
Let's see it. 3. Nice job. There's a 3. Is that a 3?
Yep.
Let's see it. 3. Nice job. Is that a 3? Another one? Let's do it. I'll wait for you. 3. There it is. For example, throw. Those types of clusters, actually, the literature continues to show that those kids tend to improve quicker, progress quicker, and become intelligible quicker than kids where we're just working on individual sounds one at a time. So I want to encourage SLPs, look into the complexity approach. It's linked down below. Parents, ask your speech therapist if they're at all aware of the complexity approach. If your child has a phonological impairment where they're just substituting a lot of sounds in their inventory, they're just not using a lot of sounds that we would expect them to have at that age, the complexity approach can be a really great option. And so I encourage you to think about what to prioritize for that child in therapy. So think about what sounds are commonly occurring. It might be a later developing sound. What sounds are going to be personal to them? Can they say their own name? Can they say important names of people in their lives? Maybe the sounds that they use for those particular individuals are going to be important to prioritize. And then think about the complexity of particular sounds. And I'm going to put my plug in here for clusters. Clusters are what can absolutely help kids improve their speech the quickest.